Welcome all to the online presentation. This presentation is prepared to cover the knowledge of clinical medicine students for NTA Level 4. And our presentation today is on Introduction to Pathology. And I, Dr. Willison Ngasa, the one who will be leading you on this presentation. So you are welcome. On this presentation or topic of Introduction to Pathology, we have our objectives through which we will be passing through. Our objectives are as follows. First objective is on meaning of pathology, whereby you as a student, you are supposed to know or understand how to define the term pathology. Another objective is on evolution of pathology, where you students at the end of this discussion, you are supposed to know how to explain evolution of pathology. Another objective is on subdivisions of pathology, whereby at the end or after this discussion, you are supposed to know and identify the subdivisions of pathology. Another objective to be covered through this presentation is on disease development, where you as a student, you are supposed to explain the disease development. Another objective is on categories of diseases, whereby after this discussion, you students, you are supposed to know or have a knowledge on how to classify the categories of diseases. And the last objective on this presentation is to explain on cell injury and cell death. But today, I have prepared for you the first 5 objectives, except for the last one, which is cell injury and cell death. This objective will be covered on other or next presentation. Okay, so taking you directly to our first objectives of meaning of pathology. The word pathology itself is derived from 2 Greek words, which are pathos and logos. Pathos meaning suffering and logos meaning study. So the term pathology, as it stands, means the study of suffering, or simply you may say it's the study of diseases. So pathology is the study of structural, biochemical, and functional changes in cells, tissues, and organs that underlie the disease. Which means that the study of pathology, when you are studying pathology, you study the changes which occur into the cells, tissues, or organ. And these changes which occur can be structural, biochemical, or functional, and are the ones which manifest as a disease to an individual. So generally, this study of pathology deals with the causes, effects, mechanisms, and nature of a disease. So there are goals of pathology to students. You as a student, why do you study pathology? There are objectives or goals of which you have to acquire after this study. First of all, you have to be able to understand and analyze the relationship between pathological changes and the clinical manifestations. Meaning that after studying pathology, we expect you to have a knowledge. From previous slide, we have seen that pathology deals with the changes which occur into the cells, tissue, and organs. And these changes manifest as certain symptoms or signs. So you, after studying pathology, you will have a knowledge which will help you to link between the pathological changes you have seen on the cell or tissue or a certain organ with the presence of the signs and symptoms the patient or one presenting with. Another goal, we expect you to be able to take a detailed clinical history and to order relevant or logical investigations or tests. Another goal is you to be able to make correct diagnosis. Also, you will be able to communicate with professionals and patients. Okay, so taking you to another objective we had on this topic, which is the evolution of pathology. Evolution of pathology began with the following concepts from different eras. So there were different periods through which so many concepts were developed regarding disease development and how diseases occur. And these concepts, first was religious and superstitious beliefs to relational approach, which was during the Antiquity period to Anno Domini 1500s. The earliest concept of disease were this, which is religious and superstitious belief, where people believed that affliction or disease was the outcome of cause or evil. So during these periods, people believed that one may develop a disease when he or she has a certain evil. Kwa Kiswahili tunasema dhambi. So the real practice of medicine began in the years 460 to around 377 before Christ. And Hippocrates introduced an ethical concept in the practice of medicine and was admired by the medical practitioners or professions by taking Hippocratic oaths at the time of entry into the practice of medicine. So another era, another period was the period of gross pathology, which was during the Anno Domini 1500 to around 1800s, where in this era, the discovery of science in diagnosis involved the studies by dissection of human body, the autopsies, and the use of microscope in examining the diseased tissue of cells. So there are some advancements during this period. And then also followed by the period of technology development and cellular pathology, which was during the Anno Domini 1800 to around the 1950s. Where this era, during this era, the technology of microscopy was advanced to involve different staining methods or techniques, the use of electron microscopes to examine and view ultrastructures of the cell and its organelles. And it was during this era where Papa Nicolau developed the use of exfoliative cytology for early detection of cervical cancer. The last one was the era of modern pathology, which was during the 1960s up to around 21st century. The major advances in molecular biology in the field of diagnosis and treatment of genetic disorders, immunology, and in cancer was evolved during this era. And those advances included the description of the structure of DNA, identification of chromosomes and their numbers, the recombinant DNA techniques, and the mammalian cloning. After that evolution of pathology, we have another objectives we have is on subdivisions of pathology, how pathology is subdivided. So pathology has branches as follows. We have general pathology, we have systemic pathology, and also we have histopathology, as explained below. General pathology, this deals with the general principle of disease. It deals with the general principle of disease, such as is concerned with the basic reaction of cells and tissue to abnormal stimuli. So when there is an abnormal stimuli, the way the cell or tissue reacts to that abnormal stimuli, which may lead to a disease, that is the concept which explained about general pathology, is explained in general pathology. So general pathology deals with just a reaction of the cell or tissue to a certain stimuli. But systemic pathology, this includes study of diseases pertaining to the specific organs and the body system. So systemic pathology, it will just try to examine the specific responses of specialized cells. So cells are specialized in different organs with different functions. So systemic pathology examines the response of different cells, different specialized cells or tissue to more or less well-defined stimuli. And another type or branch we have seen is histopathology. And this histopathology is further more subdivided into as subdivisions as follows. We have surgical pathologies, which deals with the study of tissues removed from the living body. So a certain tissue is removed from the living body and then is examined pathologically. Also, we have forensic pathology and autopsy work, which includes the study of organs and the tissues removed at postmortem. Postmortem means after death. And also we have cytopathology, which includes the study of cells shed off from lesions, like in explorative cytology and finding aspiration cytology of official and deep-seated visions of diagnosis. Okay, another objective we have is on disease development. There are 4 aspects of a disease process that form the core of pathology. And these aspects are etiology, where under etiology we look on the cause of the disease. Also there are pathogenesis, where we check on the mechanism by which a disease develops. But also there are morphologic changes. Here at morphologic changes we check on the structural alterations which are induced in the cells and organs of the body. And finally, there is clinical significance, where we learn on the functional consequences of a certain or morphological changes which have been occurred due to a certain stimuli. So this is a pictorial presentation of disease process, starting from etiology, where we have an etiological factor or a causative agent or a stimuli which may go and affect a certain cell or tissue or organ, and then this impacts a certain mechanism which affects that cell or tissue, and that mechanism is known as pathogenesis. And later on, the changes which occur due to that mechanism which have been occurred lead to a certain morphological or molecular changes within that organ or tissue, and then those changes may impair a normal functioning of a certain organ and hence manifest as certain symptoms or signs and hence regarded as a disease. So starting with the first aspect, which is of etiology or causes. And in pathology we try to think what causes a disease. What causes diseases? There are 2 major classes of etiological factors, 2 major groups of causative agents of diseases. And these groups are classified into intrinsic factors, intrinsic or genetic factors. Another group is acquired or environmental factors. The intrinsic factors are the ones which are within an individual. For example, inherited mutations and disease-associated genes, variant or polymorphism. These are the factors which or where one is born with due to a certain gene. Somebody or someone is predisposed to a certain development of a certain disease. For example, the people with blood group A is associated with increased incidence of pernicious anemia and gastric cancers as compared to other blood groups. Another class of etiological factor is acquired or environmental factor. And these are the factors which are outside, external from the body or from an individual. And this can be infectious, nutritional, chemical, or physical agents. So these agents may cause a certain development of a disease into the body. So generally, majority of diseases are multifactorial. Multifactorial meaning that the causative agents, the causes of the disease are from different factors, are not from just one factor. So there might be interplay of both the intrinsic and the acquired or environment factors to cause a certain disease. And sometimes the causative agent can be idiopathic, or simply by saying can be unknown. Another aspect of disease development is pathogenesis. Pathogenesis is simply the sequence of events in the response of cells or tissue to etiological agent. So once the etiological agent or a stimuli comes to a cell, certain cell or tissue, the way the cell or tissue responds to that agent, to that agent later on can be manifested as a certain symptom or sign, or generally known as clinical manifestations. So the sequence of events in the response of cells or tissue of the etiological agents from the initial stimuli to the ultimate expression of the disease. So that is pathogenesis. So even when the causative agent is known, it takes many steps to get the expressed disease. So you may have a certain causative agent which is very known, but for a disease to develop, there are some changes which must be occurred within the body, within the cell, tissue, organ, for the disease to develop. So pathogenesis or disease development is an ongoing process. Another aspect is on molecular and morphological changes. These changes refer to the structural alterations in cells or tissue that are either characteristic of a disease or diagnostic of an etiological process. Here, on molecular and morphological changes, we look on the specific cells, specifically affected cells or tissue. We check for the changes which have occurred due to contact with a certain stimuli, and these changes may be directly linked to a development or characteristic of a certain disease, or can be used as diagnostic for the causative agent or etiological process. So the practice of diagnostic pathology is devoted to identifying the nature and the progression of a disease by studying morphological changes in tissue and the chemical alterations in patients. And the last aspects of disease development on clinical manifestation, as we have seen previously, starting from etiological causes. So once you have a stimuli which goes and affects a certain cell, then there are pathogenesis or mechanism by which cell changes. There are changes which occur within the cell which may affect general or the morphological, molecular arrangement of that cell, which later on impairs the functioning of that cell or organ in general, and then it can be manifested clinically. So the last aspect of disease development is clinical manifestation. So this is the end result of genetic, biochemical, and structural changes in cells and the tissues have function abnormally. So after disease development, after a certain stimuli affecting a cell, mechanism of injuries occur within the cell, and later on there are some changes which occur within the cell and the organ in general. It tends to affect the functioning of that organ, leading to abnormal functioning of that organ, and hence that can be manifested as a certain disease or characteristic of a disease. Sir Rudolf Virchow concluded that all diseases start with molecular or structural alteration in cell. So for a disease to develop, there must be a certain alteration in the cells, certain alteration, or either molecular or structural alterations in that cell for it to function abnormally, and then an organ can be abnormal functioning and hence can be manifested as a disease. So the morphological changes in the organ influence the function of the organ. So if the organ have not any changes, then it will be functioning normally. But once there are stimuli which affect a certain cell, tissue, or an organ in general, and these morphological changes occur, then the functioning of that organ can be impaired, and hence the function in general can be blocked or impaired, and the person may present with a certain manifestations which can be a characteristic of a certain disease. So by doing so, determine the clinical features and so forth as we have seen. So another objective we have on today's presentation is on classification of disease. So diseases, after we have seen how diseases develop, so these diseases can be classified into different classifications. So we have generally these two categories of classifying diseases. So first you can classify disease based on etiology, and also you can classify disease based on bodily defects or body response. First, so on based on etiology, you can classify disease considering the causative agent of it. For example, under this etiology, we have two classifications, which is we can have genetic disorders, or simply can say inherited ones, and we have acquired disorders, whereby one can develop a disease due to presence of a certain gene or certain mutation within his or her body. But also, an individual can develop a disease due to presence of external environment or an stimuli from external environments, and this can be acquired disorders, like those including infections, nutritional deficiencies, physical or chemical injuries, which may lead to disease development. Another classification you have seen is based on body defect or response. So once you have an infection or you have a stimuli which comes to your body, so the body responds in its own way. So under these categories, we have 4 categories or classes of diseases. We have congenital diseases, which are the diseases where someone is born with. We have inflammatory diseases, degenerative diseases, and neoplastic diseases. So this is a category of classifying disease based on the body defect or body response. Okay, so thank you. And under this discussion of today, we have our key points here, which you may use it to review or as a summary. As pathology is a scientific study of structure and the function of the body in disease, and it deals with causes, effects, mechanisms, and the nature of a disease. And we have seen this pathology is divided into some branches. Mainly we have general pathology, systemic pathology, and histopathology, as we have seen in the previous explanations or slides. So disease is a loss of ease of body, or simply is the opposite of health. What is not health is diseased. So, and these are some few questions for self-evaluation. So you students, so you have to, after completion of this discussion, you have to define what is pathology from your knowledge after this discussion. Also, you have to give us what are the subdivisions of histopathology, and then which factors contribute to disease development. Thank you, and these are some references which you may use to read on and improve your knowledges on this introduction of pathologies. Thank you.